When a person loses blood, perhaps during an accident, surgery or childbirth, they lose vital components in their blood, and their blood volume drops. The reduced volume causes a drop in blood pressure, making it more difficult for blood to circulate the body. Our bodies will eventually produce blood to replace the lost blood, but this takes some time. So sometimes doctors will give patients a transfusion to quickly replace the blood that has been lost. In this case, whole blood is often given to the patient. This means blood that has not been filtered or changed in any way.
Hello! Today we will be talking about blood product for blood transfusions. What is blood transfusion? Blood transfusion is a medical procedure in which blood or blood products are transferred from a donor to a patient through vein. Why are blood transfusion important? Blood transfusion help to replace blood loss due to accident, due to surgery, due to diseases and childbirth. They are essential for saving life and supporting treatment. Real life importance. Worldwide receive blood transfusion every year. Trauma victims, cancer patients, and people with blood disorder depends on donated blood. What are blood products? I will explain about the definition, how does it separate, and also the benefit of component therapy. Blood products are different components separated from donated blood for the medical use. After donation, blood processed into red blood cell, RBC, platelets, plasma, and cryoprecipitate. One blood donation can help several patients with different components can be given to the patient to the different medical notes. What are the major blood products used for transfusion? First will be packed red blood cell. Second will be platelet. Third will be fresh frozen plasma. I will be explaining on the functions of packed red blood cells, use of packed red blood cells, and the benefit of packed red blood cells. The function of packed red blood cell is carry oxygen from the lungs to the body tissues. The use of packed red blood cell is for anemia and a major blood loss from trauma or surgery. The benefit of packed blood cell is to increase oxygen supply and reduce symptoms such as fatigue and weakness. Function of platelet is to help blood clot and stop bleeding. The use of platelet is for thrombocytopenia to reduce platelet count, and it also helps for cancer patient for receiving chemotherapy. And the benefit use of platelet is to prevent excessive blood loss or bleeding. Next, the function of fresh frozen plasma, which contains clotting factors and proteins. Use of fresh frozen plasma is for liver disease, bleeding disorder, and also massive blood loss. The benefit of fresh frozen plasma is to help blood clot normally. The function of cryoprecipitate, which contains fibrinogen and also clotting factors. The use for cryoprecipitate is for low fibrinogen levels and for certain bleeding factors. The benefit of cryoprecipitate is to improve blood clotting. Next will be blood group compatibilities. First we have A, B, AB, and O. Not only that, we have rhesus factors. In the rhesus factors, we have positive and also negative. Moving forward to the process of blood transfusion. Under blood transfusion process, we have 6 steps. First step, will be blood donation. Second will be blood testing. Third will be blood processing. Fourth will be storage. Fifth will be transfusion. Sixth will be monitoring.
Hello, good day to everyone. My name is Norazah bin Abdul Hamid, and today I would like to explain a little bit about blood product for transfusion, which is there is a few component that I want to explain about this title. So first point, I want to explain about the benefit of blood product transfusion. Number two, risk factor. Okay, risk factor of blood product transfusion. Number three is importance of the blood product transfusion, and number four is awareness of the transfusion, blood product transfusion. And then at the end of this session, I will wrap up everything in one conclusion. Okay, so we move to number one, which is benefit for blood product transfusion. Okay, so blood product transfusion is important medical treatment used to replace the blood component that are deficient or lost due to disease, injury or surgery. So the benefit will include restore the blood volume after severe blood loss. So blood will be lost in a few factors such as trauma, injury, for surgery, and might be because of the haemopoietic disease such as anemia, sickle cell anemia. Okay, so improve oxygenation delivery to tissue through the red blood cell transfusion also is one of the benefits. And number three is correct clotting abnormality with plasma and clotting factor replacement. So in the blood itself, they also contain the platelet, whereby we can correct the patient platelet by transfuse the blood as well, and prevent or control bleeding through the platelet transfusion, as I explained just now, as I told you just now, and then improve survival and recovery in critical ill patient. Most of the patient that involved in traumatic injuries such as accident, okay, they need to improve the survival and recovery by transfuse the blood. Okay, so traumatic injury such as accident, MVA, motor vehicle accident, there will be lost a lot of blood. Okay, and support treatment of conditions such as anemia, leukemia, and hemophilia and major trauma, as I explained just now. Okay, now we go to number two, which is a risk factor of blood product transfusion. There is a few risk factor before, during, and after the transfusion of blood to the patient. Although transfusion is generally safe, some risks may occur, such as allergic reaction ranging from mild rashes to severe anaphylaxis. Okay, so for acute allergic reaction, we can correct, we just stop the blood transfusion as soon as possible, whereby when if the transfusion is not stopped, and then the anaphylactic reaction will be occur to the patient, so they will involve they will give harm to the patient lah. Okay, anaphylactic shock. Febrile non-hemolytic transfusion reaction, fever and chills. This one is the most common for those patients receive the blood product, whereby the patient will having a fever and chills a little bit, but the regardless of temperature will be spiking up or not, will be still need to monitor during the blood transfusion product to the patient. Hemolytic transfusion reaction, HTR, due to blood group incompatibility. That's why they will give the they will do the cross match GSM and group whole and screening GSH GHS, group whole and screening before transfuse blood to the patient. Okay, and transmission of infection disease, this one is very rare due to rigorous screening and iron overload in patient requiring repeated transfusion. So for those patients that require repeated of transfusion, there may occur of iron overload in their body. Okay, and human errors such as incorrect patient identification or blood matching. So this one also is very high risk for those patients that receive the blood product, okay, or blood transfusion. So we move to the importance of blood transfuse blood product transfusion, whereby there are few importance plays a vital role in modern healthcare, because this blood transfusion can save life during emergency, accident and major surgery, as I told earlier, and maintain adequate oxygen carrying capacity of the blood. So inside the blood itself, there will be hemoglobin carrying the oxygen, so that can be improved or maintain the adequate oxygen carrying capacity of the blood for those patients receive the blood product. So it also helps manage a bleeding disorder and coagulation defects, okay, and support cancer patient undergoing chemotherapy. Sometimes for those patients that undergo for chemotherapy, they will develop anemic, okay. So for chemotherapy patient, we need to monitor their HB, hemoglobin level before and after of session, okay. So normally they will give the blood product if there is indication for patient undergo for chemotherapy that reduce in hemoglobin reading. Improve quality of life, QOL, for patients with chronic hematological disease such as anemic, sickle cell anemia and thalassemia, and enable advanced surgical and medical procedure to perform safely. Okay, so normally before the surgery, before the patient will undergo the surgery, okay, so the group and cross match will be taken, and they will stand by the blood product, either PET cell, normally the PET cell lah, okay, it's depending on the doctor order. And we go to the last one, which is awareness regarding the blood product transfusion. So awareness among healthcare professional and public is very important to ensure safe transfusion practice, whereby we need to understand the indication and contraindication of transfusion. So why we need to give the blood product to the patient, why we need to transfuse the blood to the patient. So we need to know that the indication of contraindication of transfusion before transfuse the blood product to the patient itself, and promote voluntary blood donation to maintain adequate blood supply. So this one, I believe that MOH will do the yearly campaign to those public want to donate their blood, okay, and ensure proper blood typing, cross matching and screening procedure before transfuse the blood. And we need also to monitor the patient closely before, during and after transfusion, as I told you just now, and educate patient about the potential benefit and risk, encourage prompt reporting of any transfusion later adverse reaction, and follow strict transfusion protocol to minimize error and complication as well. So I believe that PDN or Pusat Darah Negara or a blood bank, they will do the strict SOP for those patients who want to transfuse the blood before, during and after the procedure. So let me wrap up towards the end. Let me wrap up of the session, whereby the blood product transfusion is life-saving intervention that provide essential blood component to the patient with blood loss, anemic, bleeding disorder or other medical condition. While transfusion offers significant benefit, they also carry a potential risk that require careful screening, monitoring, and adherence to safety protocol. Increased awareness and responsible use of blood product will help ensure effective treatment, improve patient outcomes, and maintain a safe and sustainable blood supply. Okay, I think that's all from my end. I hope this video will give some valuable input for those audience watching this presentation, this video. Okay, thank you. That's all from me. Thank you.